A wound dressing made from donated human tissue, acquired from tissue banks, relabeled, marked up 2,000%, sold for up to $1,450 per square centimeter, and billed to Medicare for $4 billion. This is the story of a nationwide kickback scheme involving amniotic wound allografts, a product category that went from $200 million in annual Medicare billing in 2019 to $14.4 billion in 2025. The person at the center, a vice president of sales who allegedly received $24 million in proceeds and bought a $135,000 Maserati. This is not science fiction. This is the largest wound care fraud case in U.S. history. The product: amniotic wound allografts. Wound patches made from dehydrated amniotic membranes, tissue from donated placentas. Marketed as providing growth factors that accelerate healing of chronic wounds. Approximately 8.8 million Americans suffer from chronic wounds. Diabetic foot ulcers, pressure injuries, wounds that won't heal. A desperate population. And a reimbursement system that, until recently, paid generously. Medicare's payment structure created a window. Manufacturers set an initial price, reimbursed at weighted acquisition cost plus 6%. It took at least 1 quarter for an average sales price to be established, during which manufacturers could charge essentially whatever they wanted. The result? Spending per quarter on skin substitutes ballooned from $389 million in Q3 2022 to $2.8 billion in Q3 2024. The company at the center did not manufacture allografts. It acquired them from tissue banks, relabeled them, and sold them at a 2,000% markup, up to $1,450 per square centimeter. The business model wasn't healing wounds. It was arbitraging Medicare reimbursement. To drive volume, the company allegedly paid illegal kickbacks of approximately 40% of the billed amount to marketers and medical providers. This meant marketers and providers pocketed roughly $500 to $600 per square centimeter applied. The incentive was not medical necessity. It was financial yield. The mechanics. Here's how the scheme allegedly worked. Stage 1. Acquisition. The company purchased allografts from tissue banks at standard wholesale prices. Stage 2. Relabeling. The products were repackaged under the company's brand. No manufacturing, no clinical trials, just new labels. Stage 3. Pricing. The company set prices at up to $1,450 per square centimeter, a 2,000% markup over acquisition cost. Stage 4. Kickbacks. The VP of Sales and others allegedly paid approximately 40% of the billed amount back to marketers and providers who prescribed and applied the products. Stage 5. Billing providers billed Medicare. Medicare paid. The company collected. Stage 6. Application. The allografts were allegedly applied to hospice patients who would not benefit, superficial wounds that didn't need them, infected wounds without proper infection treatment, areas far larger than the actual wound size. From approximately December 2021 through June 2024, providers billed Medicare over $4 billion for this company's allografts. Medicare paid over $2 billion. The enrichment. The VP of Sales allegedly received over $24 million in proceeds from the scheme. He used the money to purchase multi-million-dollar houses, million-dollar life insurance policies, a $135,000 Maserati, luxury watches. This was not a side business. This was the business. The detection. The scheme was detected not by a whistleblower, not by a patient complaint, by data analytics. The DOJ's Healthcare Fraud Unit Data Analytics team detected a massive spike in allograft billing, from less than $200 million in 2019 to $14.4 billion in 2025. This spike was the fraud signal. The government didn't need an informant, it needed a spreadsheet. In response, CMS cut Medicare's allograft reimbursement to $127 per square centimeter effective January 1, 2026. Without this action, DOJ stated, the Part B premium increase caused by allograft payments alone would have cost every Medicare beneficiary an extra $11 per month. The bust. On June 23, 2026, the DOJ announced charges against 11 defendants across 6 federal districts in connection with allograft fraud schemes. The VP of Sales was charged in the District of Arizona with conspiracy to commit healthcare fraud and illegal kickbacks. The government also seized over $182 million in cash, luxury vehicles, jewelry, and other assets across the broader takedown. This was the largest healthcare fraud enforcement action in DOJ history. 455 defendants, $6.5 billion in alleged fraud, 56 federal districts. The amniotic allograft fraud scheme exploited a genuine medical need, chronic wound care, and turned it into a kickback-driven billing machine. The product was real. The tissue was real. The patients were real. But the medical necessity was allegedly fabricated. The prices were inflated by 2,000%, and the payments were allegedly driven by kickbacks rather than healing. And it was detected not by investigators knocking on doors, but by algorithms detecting billing anomalies. If you found this investigation useful, subscribe to Financial Crimes Explained, where we follow the money, one case at a time.